Hi, I'm Dr. Chelsea. Welcome to Seaside Smiles Pediatric Dentistry. It helps us to establish a dental home for every patient. A dental home helps to establish good early preventative care, instruction to the parent for not only brushing and flossing, but also for the development of teeth, early trauma that commonly occurs in young infants and toddlers, as well as just establishing a good rapport with the patient and the parent for a lifetime of good dental habits. We love to make this environment very fun so that instead of a scary visit to the dentist, kids can have an enjoyable, fun environment to come to learn about how to take care of their teeth and to keep their teeth healthy and strong. We try to have fun appointments every 6 months for their recalls, as well as do things like our No Cavity Club, which kids strive to be a part of, and they love to cheer each time that they are awarded with this certificate on their way out the door. And they're also entered into a raffle to win a prize every month for the No Cavity Club. There are quite a bit of kids who suck their thumbs, suck their fingers, and sometimes even have a pacifier habit or a blanket habit. The APD does recommend stopping these habits by age 3 to prevent them from affecting the developing dentition. We do offer things like a nail polish to help prevent them from sucking their thumb. We talk about giving away the pacifier to a baby in need, and things like getting rid of their blankie because they're a big boy or big girl now, to help try to move them away from the habit and towards a healthier oral environment. We try to help this by referring to the orthodontist and using them to be able to try sometimes habit appliances if the habit is still a problem. We have habit breaking appliances that can be placed on the molars that help prevent the child from being able to place their thumb or their pacifier in their mouth, as well as starting phase 1 orthodontics to help bring the teeth into a normal occlusion, open up their bite like necessary in the back where cross bites commonly occur due to habit, and we just work closely with the orthodontist to help facilitate that treatment. Oral hygiene is always a concern at age 7, and we always try to stress prevention here at Seaside Smiles. So we're always discussing how best to be brushing and flossing. A lot of 7-year-olds can get decay. A lot of cavities can start even in between the teeth for our healthiest of brushers. If they're having a high sugar diet, lots of high sugar drinks and candies and sweets can cause cavities, and we also do see a lot of gingivitis just from not flossing and brushing adequately along the gum lines. So we do see a lot of those concerns. We also see a lot of malocclusion presenting early at age 7, including cross bites, crowding, many of concerns that the orthodontist can help us address. Really, we encourage just not to be afraid of losing your tooth. We talk about how fun it is to have the tooth fairy visit their house. And we do talk about wiggling the tooth kind of left and right and spinning it around to try to help it dance its way out of the mouth. At age 7, it's very important to have had what we call a growth and development x-ray to help determine where the developing teeth are and maybe what the concerns are with proper eruption and any teeth that are being impeded from growing properly. A lot of times if the patients are unable to get the baby teeth out on their own, sometimes we will have to help the teeth out. We talk about making the teeth dance for the tooth fairy here at our office to make it a fun, enjoyable experience that's less fearful for the patient. My favorite story from a 7-year-old probably has to do with losing their first tooth. The other day we actually had a patient that had a super wiggly tooth when he was here for his cleaning, and he was determined to get it out. He sat up afterwards, asked for a gauze, and took the tooth out all by himself, and we all cheered. So it's really exciting to see 7-year-olds being excited about losing their first tooth and having the tooth fairy come to visit.
Hi, my name is Dr. Lee Legler from Legler Orthodontics. And thank you for joining our Summer of 7 series. This is part 2, and Dr. Chelsea Garcia from Seaside Smiles has joined us, and we thank her for sharing her expertise with our viewing audience.
Now, one important point I want to make is that it's very important that the dentist that you bring your child to not only has a comfortable, welcoming environment so they're not intimidated, but also that your dentist is very capable of detecting early warning signs at age 7 in the developing mouth. Now, these can be problems with tooth size or jaw length. but they're all usually very evident. Now, of all the 7-year-olds we see, only about 50% require treatment. The other half would give you an idea about future orthodontic needs, and then see them on a recall program and start their treatment when they're about 11 or 12. The other half require treatment, and usually the reason falls into about 3 or 4 different categories. Some have problems, what we call dental problems, where the size of the teeth doesn't match the size of the jaws. Some kids might require early extraction of primary teeth and space maintainers or expanders. We also see kids that have the bad effects of thumb sucking or tongue thrusting, in which case the front teeth aren't able to erupt fully and they have what we call an open bite. Sometimes the jaws are also too narrow. So for these types of cases, we not only use braces, but also appliances to help fully stop that thumb habit and tongue thrust, and basically realign the jaws or the arches so that they can grow more normally. And then the last category are what we call skeletal problems, where one jaw grows too much or too little. For instance, an overbite or protrusion of the upper teeth, or an underbite where the lower jaw has grown too much or the upper jaw not grown enough. So these types of cases require what we call a 2-phase treatment, where some treatment at the ages of 7 to 9, we call it a first phase, they might require braces, appliances, space maintainers. We can not only make more room for teeth to erupt, but we can also modify the growth or the size of the jaw so they fit together. So then when your child proceeds through their adolescent growth spurt, their growth is more normal. Our ultimate goal is to minimize the need for extraction of permanent teeth, gum tissue grafts, and in severe cases, jaw surgery to move a jaw forward or back. So any improvement we can make on this, we feel is very valuable.
If you have any questions concerning any of these issues, please give our office a call and we'd be glad to see your child for a complimentary consultation. Again, thank you for joining us and we hope we've been of help. Thank you.